Hello, and welcome back. Irritable Bowel Syndrome, IBS, and Inflammatory Bowel Disease, IBD, are two distinct gastrointestinal disorders that often get confused due to their similar names and overlapping symptoms. However, they differ significantly in their pathophysiology, diagnostic criteria, and treatment approaches. I will discuss the differences and similarities between IBS and IBD, explore their diagnostic processes and conventional treatments. Make sure and stay until the end so you can learn natural treatment options. IBS is a functional gastrointestinal disorder characterized by chronic abdominal pain, bloating, and altered bowel habits, including diarrhea, constipation, or a mix of both. It is classified into 4 subtypes based on the predominant bowel habit: IBS-D, diarrhea predominant; IBS-C, constipation predominant; IBS-M, mixed; IBS-U, unclassified. IBS does not cause inflammation or permanent damage to the intestines. It is believed to result from a combination of abnormal gastrointestinal motility, heightened visceral sensitivity, and gut-brain axis dysregulation.
It's a group of symptoms that happen together. And so basically you have to start with having abdominal pain. And that abdominal pain will occur alongside some sort of change in the bowels. So it could be diarrhea, constipation, or a combination of both. Now, the symptoms of IBS may change over time, but IBS is often lifelong. This is not something that you can just cure with antibiotics or something like that. But it's something that you can manage. It's something you can manage to the point that it doesn't necessarily affect your quality of life. IBS is interesting because although it's a bowel disease, it doesn't increase your risk of developing bowel cancer or other bowel-related issues. The mystery around IBS is that even though this is so common, we don't know exactly what causes it. Although I will say we have some strong clues that we'll talk about today.
And Will, it's really common, right? So we looked at the latest data, and IBS affects about 1 in 10 people worldwide. In North America, it's estimated that 10 to 15% of the population have it. It's less prevalent in people aged over 50, and it's also more likely to affect women than men.
It's very important that when you visit your doctor, you discuss all your symptoms and history, as IBS has overlapping symptoms with other gastrointestinal conditions. Now let's define IBD. It is an umbrella term for chronic inflammatory conditions of the gastrointestinal tract, primarily Crohn's disease and ulcerative colitis. Crohn's disease can affect any part of the gastrointestinal tract from the mouth to the anus, but most commonly affects the terminal ileum. It is characterized by transmural inflammation, which can lead to complications such as strictures, fistulas, and abscesses. Ulcerative colitis primarily affects the colon and rectum, causing continuous inflammation and ulceration of the mucosal layer of the colon. It often leads to symptoms like bloody diarrhea, urgency, and abdominal pain. Unlike IBS, IBD involves an abnormal immune response that causes chronic inflammation and can result in severe complications, including an increased risk of colorectal cancer. Let's look at symptom similarities and differences. Abdominal pain and cramping. Both IBS and IBD patients experience abdominal pain and cramping, although the nature and severity can vary. Bloating and gas. These are common in both conditions, contributing to discomfort and distension. Altered bowel habits. Diarrhea and constipation are common in IBS, while diarrhea, often bloody, is a hallmark of IBD. Symptom differences include blood in stool. A key distinguishing feature, IBD often presents with bloody stools due to intestinal inflammation, whereas IBS does not typically involve blood unless due to hemorrhoids or other non-inflammatory causes. Weight loss and fatigue. Unintended weight loss and severe fatigue are more indicative of IBD due to chronic inflammation and malabsorption, whereas IBS generally does not lead to significant weight loss. Fever. Low-grade fever can occur in IBD during flare-ups, while it is not associated with IBS. Mucus in stool, common in IBS. Mucus in the stool can also be seen in IBD, but is less specific. Again, remember that when you visit with your physician, it is important to discuss all your symptoms to ensure you are properly diagnosed. Diagnosis of IBS is primarily based on clinical criteria, as there are no specific tests for IBS. The Rome-5 criteria are commonly used, which require recurrent abdominal pain at least 1 day per week in the last 3 months, associated with 2 or more of the following: pain related to bowel movement, change in stool frequency, change in stool form or appearance. Additional tests may be performed to rule out other conditions, including blood tests to rule out anemia, infection, or other diseases. Stool tests to check for infections or inflammatory markers. Colonoscopy to rule out IBD or colorectal cancer, particularly if there are alarm symptoms like weight loss or rectal bleeding. Diagnosis of IBD involves a combination of clinical evaluation, laboratory tests, imaging studies, and endoscopic procedures. Key diagnostic tools include blood tests to check for anemia, elevated inflammatory markers, CRP, ESR, and specific antibodies, ASCA, PANCA. Stool tests to detect fecal calprotectin or lactoferrin, which indicate intestinal inflammation. Endoscopy. Colonoscopy with biopsy is crucial for diagnosing IBD, allowing visualization of inflammation and obtaining tissue samples. Imaging studies, MRI or CT enterography, to assess the extent and severity of inflammation, particularly in Crohn's disease. So how do we treat IBS and IBD? IBS can be treated most effectively through dietary modifications. The low FODMAP diet, which reduces fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which are short-chain carbohydrates and sugar alcohols found in some foods. Reducing these has been shown to alleviate symptoms in many IBS patients. Identifying and avoiding trigger foods is also crucial. Medications can help: antispasmodics to reduce abdominal pain and cramping, laxatives for IBS-C to relieve constipation, antidiarrheals for IBS-D to control diarrhea, probiotics to restore gut flora balance, and antidepressants. Low-dose tricyclic antidepressants, or SSRIs, can help modulate pain and improve bowel habits. There are also psychological therapies, which include cognitive behavioral therapy, hypnotherapy, and stress management techniques. They can be effective, addressing the gut-brain axis component of IBS. Treating IBD is a little different. Medications can help: 5-ASA, used primarily in UC to reduce inflammation, corticosteroids for short-term use during flare-ups to control inflammation, immunomodulator to suppress the immune response, biologic therapies to target specific pathways in the inflammatory process, and JAK inhibitors, a newer class of medications for moderate to severe UC. Surgery can be required for complications or when medical therapy fails, including resection of diseased bowel segments in Crohn's disease or colectomy in severe UC. There is also nutritional support, enteral nutrition, or specific dietary plans to ensure adequate nutrient intake and manage symptoms. There are natural treatments for IBS and IBD. However, it is important to discuss all treatment protocols with your physician. Natural treatments for IBS include dietary fiber. Soluble fiber supplements like psyllium can help regulate bowel movements. Peppermint oil. Known for its antispasmodic properties, it can reduce abdominal pain and bloating. Probiotics. Certain strains like Bifidobacterium and Lactobacillus have shown promise in alleviating IBS symptoms. herbal remedies, such as turmeric and ginger, which have anti-inflammatory and digestive benefits, mind-body therapies. Yoga, meditation, and acupuncture can reduce stress and improve gastrointestinal function. Natural treatments for IBD include anti-inflammatory diets, such as the specific carbohydrate diet, SCD, and the Mediterranean diet, which focus on reducing inflammation through food choices. Omega-3 fatty acids. Found in fish oil, they have anti-inflammatory properties and may benefit IBD patients. Curcumin, an active compound in turmeric, which has been shown to reduce inflammation in IBD. Aloe vera may have soothing and anti-inflammatory effects on the gut. Prebiotics and probiotics, to enhance gut flora and reduce inflammation, although more research is needed in IBD compared to IBS. There is promising research being done in the area of gut health. Microbiome research studies are increasingly focusing on the role of gut microbiota in both IBS and IBD. Researchers are exploring how alterations in the microbiome can trigger or exacerbate these conditions, and how probiotics or fecal microbiota transplantation, FMT, can be utilized for treatment. Genetic and epigenetic studies investigating genetic predispositions and how environmental factors influence gene expression related to IBS and IBD. Biomarker research identifies specific biomarkers for more accurate diagnosis and monitoring of disease activity in IBD. Novel therapeutics development of new medications targeting specific molecular pathways involved in inflammation and immune response in IBD. There is even personalized medicine tailoring treatment plans based on individual patient profiles, including genetic, microbial, and immunological factors, to improve outcomes. Understanding the distinctions and overlaps between IBS and IBD is crucial for accurate diagnosis and effective treatment. While IBS primarily requires symptom management and lifestyle modifications, IBD involves more complex medical and sometimes surgical interventions due to its inflammatory nature. Both conditions benefit from a holistic approach that includes diet, medication, and mind-body therapies. Ongoing research continues to uncover new insights and treatments, offering hope for improved quality of life for those affected by these challenging gastrointestinal disorders. Thank you for watching this video, and stay tuned for more information on how you can improve your gut health. See you next time.